Hey everyone, and welcome. Thank you for joining us. As part of Healthy Vision Month and the ADA's Focus on Diabetes initiative, today's ADA Roundtable will be focusing on the pandemic and its impact on people living with diabetes and their eye health. My name is Chris Rudin. Some of you may recognize me from the Rocks TV show Titan Games. I'm a keynote speaker, author, record-holding powerlifter, and today I'll be moderating this panel of health experts and patients. Now, before we go into some questions, I'd love to kick it off by introducing everyone. And we can start with you, Dr. Gabay.
Hi, I'm Bob Gabay. I'm the Chief Scientific and Medical Officer here at the American Diabetes Association, and so pleased to be part of this event today.
Dr. Reynolds.
Hello, everyone. My name is Dr. Cheryl Reynolds, and I'm really honored to be part of this panel today. I am an associate professor at Nova Southeastern University College of Optometry in Fort Lauderdale, Florida, and I'm director of our Diabetes and Retina Service. So I'm really excited to be part of this discussion. Thank you for having me.
Dr. Singh.
Hi, Rishi Singh from Cleveland Clinic in Cleveland, Ohio, and I'm a professor of ophthalmology. My specialty is treating medical and surgical retinal diseases. And it's my pleasure to be with all of you today.
And Natalie.
Hi, everyone. I'm Natalie Carabo. I'm thrilled to be here. I've lived with type 1 diabetes for 30 years, and I'm here to provide tips from my experiences living with diabetic retinopathy.
Now let's get into some questions here. And before we go too deep, I really need to set the tone. Dr. Gabay, I'm going to start with you. How is diabetes and eye health related? How does diabetes affect the eyes?
Well, first of all, diabetes is a leading cause of blindness in the U.S., and so it's really a very strong relationship. And what happens is the higher the blood sugar, the more damage occurs to the eye, and the eye can undergo a series of different changes. But if left untreated, sadly, people lose their vision. The good news, as we'll talk about, is there's so much you can do to prevent blindness, and most blindness is preventable in relation to diabetes.
Now, Dr. Singh, do you have any input on that in relation to diabetes and the relation to eye health in general? I feel like a lot of people, including myself, when I was first diagnosed, I never really thought to connect eye health with diabetes. It almost becomes so obsessive on blood sugar management that we forget some other aspects of diabetes management. Do you have anything to add to that?
Yeah, I think when we look at the way a patient with diabetes is affected in their body, there are multiple systems that are affected. There's the macrovascular large vessel situations like the heart and the brain. And then there's a small vessel diseases that you can develop like nephropathy, which is kidney disease, neuropathy, which is nerve damage, and retinopathy, which is in the eye. And I think people sometimes don't realize that those go hand in hand with each other. And so they're focused on blood sugar, which is really important to do, don't get me wrong. But the other things are important to screen for and to treat for when they're present. And some of them are very, very effective treatments now. And what I always tell patients with diabetes, unfortunately, is that everyone will develop some level of diabetic retinopathy just by the duration of having the disease. The question becomes, if you have a blood sugar, do you end up having it in a year, 5 years, or 10 years, or maybe 35 years? It just depends on how good your blood sugar control is.
Okay, so that's a good point to make, that blood sugar control is important, but so is diabetes management in general, and it can go past blood sugar management. That's why having an eye care specialist or a diabetes health team is so important. Going into eye care specialist, Dr. Reynolds, it's confusing. It's extremely confusing as a patient, especially a new patient. I know, speaking from my own perspective, I've had diabetes for 12 years, it seems like 100. There's so many specialists. There's so many eye specialists and tests and all of these things. As a person with diabetes or a family member of someone who has diabetes, how do we decipher the world of specialists?
I like that because patients do get confused. So I'm an optometrist, and an optometrist definitely can diagnose diseases of the eyes. And in fact, we as optometrists tend to see patients with diabetes just a little bit more than the specialist, Dr. Singh, usually when they have the retinopathy or changes in the back of the eyes is when we refer them to the specialist. And also too, a lot of times, diabetes doesn't just affect the retinal blood vessels. It can also cause our patients to have blurry vision, right? So when your sugar levels are elevated, you don't see well, it's blurry. Or it can cause the patients to have fluctuating vision. I always say to my diabetics, you may have many glasses or a couple pairs of glasses, because when your sugar is high, your vision is blurry. And then when your sugar becomes normal, your vision is better again. So they come to the optometrist because they have blurry vision. And it's so critical for us. We're part of the diabetic healthcare team, not only to see these patients for their visual health, but also to check the back of the eyes. And just to let you know, sometimes during these eye exams with the optometrist, we can detect diabetic changes before they're diagnosed by their primary care physician with diabetes. Up to 30% of patients can have bleeding or some changes in the back of the eyes before they even know that they have diabetes. And so I tell my patients, when you come to me as an optometrist, I'm part of the eye care team, I'm part of the healthcare team, and we're an important part of detecting diabetes, and not just diabetes, but diabetic retinopathy. And then I'll send them on to the specialist, as Dr. Singh, who will treat the retinopathy in the back of the eyes.
So Dr. Singh, adding to that, as a specialist, what are some of those confusions that are often seen in the different kinds of specialists as well, adding to what Dr. Reynolds said?
Adding to that, I think, as Dr. Reynolds says, there's doctors of optometry and medical doctors who do various things that overlap a little bit. But I think, generally speaking, what people forget is that these are treatments, or these are visits that are paid for by your insurance company. They are medically indicated for that reason. And I think people sometimes mix up vision plans with glasses plans and medical insurance plans. And really, every patient with diabetes should know, as long as they have medical insurance, this is a covered examination that should be done once a year, or maybe even more frequently, depending on the level of retinopathy present.
I think that's the hard part, is when a lot of us are first diagnosed. I know for me and for a few other patients that I know, we're so consumed with the blood sugar that we hear, oh, once a year, okay, I'll get to that. But as both of you have said, Dr. Reynolds and Dr. Singh, it's so vital to detect. I like that word that you use, detect. And sometimes, just do the things in advance instead of being reactive, almost proactive in a sense. And I love the way you put that. Going back to you, Dr. Reynolds, why is it important to tell your eye care professionals that you have diabetes? I know we talked a little offline, which I loved, about how some people kind of hold back some of that information with healthcare. And I can see that it can be scary as a patient, but why is it so important to reveal that you have diabetes when you go to your eye care visit?
Well, it's important because, as Dr. Singh said and Dr. Gabay said, it affects all parts of the body. I tell my diabetic patients, or my patients with diabetes, that it affects from the top of the head to the bottom of the feet, right? So we want to know, do they have diabetes? What type of diabetes? Because, as Dr. Singh says, duration is important. And, the longer you have the disease, the more likely you may have some changes in the back of your eyes. We also want to know their control of their disease. One of the things that I always educate my patients on are the ABCs of diabetes. And I'll talk more when we talk about management, but I'm always asking my patients the ABCs of diabetes. What is their glycemic control? And Dr. Gabay will probably go into that, but we want their numbers to be 7 or less when they do their A1C, which is every 3 months they get that tested. So we need to know those numbers as well. We want to sort of know their blood pressure. We check their blood pressure as well as optometrists, and we want to know their cholesterol levels. And more importantly, we want to know that they're not smoking, right? Because smoking increases the risk. So those are the ABCs acronym: A1C, blood pressure, cholesterol control, and the S is smoking cessation. So we need to know those numbers. We need to know what's going on. We need to know how long they've had the disease so that we can pay more careful attention to the back of the eyes. We have instrumentation now that allow us to see or detect retinopathy before it's even clinically evident. So if I have a patient with, for example, an elevated A1C, I might do what we have is called an optical coherence tomography angiography, which is an instrument that they could sit in. It's non-invasive, and it really carefully looks at the blood vessels in the back of the eyes. It may detect some changes earlier. And one of the things that we know as eye care practitioners is early detection is critical, right? And educating the patient. The other reason that it's important for us to know as eye care practitioners we need to communicate to the other members of the diabetic healthcare team, right? So it's important for me to send a report, whether they have retinopathy or not, back to their primary care physician, back to their endocrinologist, as well as if they have retinopathy, I'm sending a report to Dr. Singh or the retinal specialist that I'm referring them to let them know that they have diabetic retinopathy, or it's affecting the macula, which is the most sensitive part of the vision. So they may have diabetic maculopathy. And then also to their progression of their disease is really critically based on how well controlled they are, right? So if their A1C is not well controlled and they have retinopathy, that allows me an opportunity to educate them, the patients, about better control, in addition to what their PCP has told them, better control, compliance with their medication, maybe some lifestyle changes, and diet and exercise. So that's why it's important that you let your doctors know. And I think you and I, Chris, talked about sometimes with patients, minority patients, they may come in and say they have a touch of sugar, or they may not claim their disease. If they say that to me, they have diabetes. I let them know. And again, it allows me to be part of the team to educate them about their condition.
I love that. And you talked about a lot of, potential treatments. And that's something I want to ask Dr. Singh. Can diabetic eye disease be treated? And if so, what kind of timely manner is a necessity?
It really depends on the level of retinopathy, and it really depends on the stage of the patient at the given time. And so it's hard to say, when should we treat? But we've learned from recent data is that even in the earliest form of the disease, some of this stuff is reversible to the point where you can cause regression. And there's very few diseases in life, as you can imagine, that you can say it regressed or it improved as time went on from a state where it was, right? So that's an initial, I think, an initial feeling on many people is that these are life-saving transformational treatments that are now available for this condition. And I think for those people that might want to get some more information on that, we have a website that's focused on diabetes initiatives like this, and it's called looktoyourfuture.com, which has a special section that looks a lot at these treatments.
Dr. Gabay, do you have anything to add to that?
Yeah, here's the thing that most people don't realize is if you catch eye disease early enough, most times you can prevent vision loss. And the sad part is only half of people get that yearly eye exam. And if they only did, you could catch it early and prevent. And, I saw a patient recently, a relatively young guy with type 2 diabetes. He's 35. He was just diagnosed with diabetes, but already had significant loss of vision because he had diabetes for a long time and didn't realize it. And they were able to stabilize his disease, but he had significant vision loss. And, he was having to explain to his 6-year-old why he can't play and do some of the things that he did before. It's so sad to see that. And the saddest part about that is it's preventable.
Yeah.
And one of the hard parts about this, and Cheryl can speak to this as well, is that patients, at least in the earliest forms, don't have any symptoms at all.
Right.
And so they come in and they're totally asymptomatic and they don't realize how bad things have gotten until too late in the stages, as Dr. Gabay was talking about that patient. So seeing them and evaluating them at an earlier phase is super important to getting an understanding about what their long-term prognosis is.
I think that's a vital point for everyone to take home, is that talking with your eye care team, your diabetes management team, to possibly, catch these things in advance, being regular with your eye care appointments and your eye care team and your diabetes management, the blood sugar, the lifestyle factors, like Dr. Reynolds says, all of the different tests. But speaking of the test, this is where it can be daunting for diabetic, a person with diabetes like myself. I know for me, I was like, go get an eye test. You know, we don't know. So they're like, oh, do you want dilated or regular? And do you want this and this? I'm like, I don't know. I just want to make sure my eyes are good, you know? So can you speak on the difference between a dilated test or any of the specific tests on what we would go into as a person with diabetes, Dr. Reynolds?
Yeah, so it's, Dr. Gabay said it, and that number I just can't gloss over. 50% of patients with diabetes are getting yearly comprehensive eye exam. That's not enough. We need 100% of the patients with diabetes. So that's why it's so important for us to work as a team, and it's important for me to communicate. Now, when they come in or they see their optometrist, it's very important that diabetic patients get a dilated comprehensive eye exam. So they should have drops in the eyes that allows the practitioner to really assess the retinal blood vessels carefully. I know there are instrumentation and new advanced technologies that can see or help us detect without dilation per se, but I recommend all patients with diabetes have a yearly comprehensive diabetic eye exam where they get a dilated evaluation. And so all of my patients get a dilated assessment, and that's so critically important because that's where we're going to detect the changes in the blood vessels in the back of the eyes, number one. And if you're not dilated, it limits my view of seeing those blood vessels. So we want to make sure that we're seeing those blood vessels carefully. And it's not just looking straight ahead. If you think about the eye like a ball and you go into the center, you're looking in the center, you'll see a limited scope of the retina. But peripheral retinal changes or changes out in the periphery is just as important. In fact, detecting early peripheral or changes out in the periphery of the retina is just as critical because that can lead to early detection and allow us to A, educate the patient, B, communicate with their healthcare team, and C, maybe refer them to the retinal specialist for further management. So a dilated eye exam, Chris, is what our diabetic patients need to have every year.
I think that's important to know for anyone listening with diabetes or family members of diabetes. As Dr. Reynolds has said, there are certain things that we require as people with type 1 or type 2 diabetes that we need these specific tests, you know, and I love that you put that. Now, Dr. Singh or Dr. Gabay, I'd love for both of you to weigh in. This is a personal question. As a person with diabetes, it can be scary going into it, whether you start to have vision effects or not, you're getting these tests. How do you have these conversations with your patients to explain to them, you know, maybe make them feel better about what's going on?
Yeah, I think it's one of the things we can tell them is that with good follow-up and good care, it's highly unlikely for any patient with diabetic retinopathy to go blind in this day and age. I can say that with a lot of surety.
Wow.
And I think that statement is probably the strongest you've heard in the past few years because our knowledge about what we're able to do surgically, medically, screening, and otherwise has really made a huge difference with regards to how we're able to do these sort of things. So speaking about how we're able to, kind of treat these patients, I think that has resonated. And when I have these conversations, as you're talking about these crucial conversations with some people, I have to tell them that I'm here for them. I'm going to be here for them. And if they just come and see me often, we can make this a great partnership, although do well long term. And that's really, I think, the key to success in any patient who has any of these conditions.
I love that so much. One of my first endocrinologists said this to me. No one cares how much you know until they know how much you care. Mm-hmm. And to have a healthcare professional that actually cares about your health, it means so much. I know for me as a person with diabetes, I never asked for this condition. None of us did. But to have a healthcare professional or team, whether it's eye care, healthcare, to have our backs, I love hearing all of you talk about that from a passionate perspective. Dr. Gabay, anything to add to that?
No, I couldn't agree more that it really is building a relationship with your healthcare team. And I really do believe that, all of the folks that go into healthcare go into it for a reason. And connecting with them as people, and them connecting with their patients as people is really the key, and the magic of that relationship I'd be interested in getting a sense of, Natalie, you've been to many eye visits, and so what is that like? What were your first feelings when you did that, and what advice might you be able to give?
Absolutely. So I definitely have always had a fear of eye doctors. It was something that I knew I had to do as a kid, kind of went along. As I became an adult, my endocrinologist appointment were always top of key, but the eye appointments always held me back because I was always just scared of what would happen. Since having eye challenges, I've learned so much just about what it means to go to an eye doctor and what really matters. The most important thing, as everyone's mentioned before, things can happen in the back of your eye that you have no idea what's going on back there. That's why it's so important to get that dilated eye exam so they can really take a good look. I know it can be sometimes scary to go to an eye appointment. I've been there many times. I cross my fingers as I'm reading the letters on the screen. But if things are caught early, there can be treatments that can be done. So oftentimes I go, I know the procedure, right? I read the letters on the screen. I have my pressure checked. Depending if I have treatment that day, I get my eyes dilated. Scans are taken just to see what's going on and also to check if there's any changes from the time before. And then I have a meeting with my doctor. My approach this time versus when I was younger is much different. I kind of treat it as a conversation, right? He explains to me what is going on. He discusses what the options are. I ask my questions and I actually write them down before my visit because sometimes it can be so overwhelming when I get there or I forget something and I don't think I should call back. If I'm not sure whether or not I make an appointment, I think to myself, what would future me want me to do? And the answer is always the same. I will do whatever I need to do to make sure that I have my vision.
Yeah, I think that's really important. And I can't wait till we dive into the patient aspect of this after we talk about some of these communities. And Natalie, you and I see eye to eye, so to speak, on a lot of things. So I'm really excited to get into those conversations. Now, something that's affected us as patients, I'm sure as healthcare professionals, this pandemic. This pandemic has affected all of us in the way we treat and so many different factors, but it's really hit a few people hard. Dr. Reynolds, how has this pandemic really hit the underserved communities, especially those with diabetes? We all talked about this off camera, but I would love for you to kind of talk about those impacts of the pandemic as it relates to those underserved communities.
Thank you so much for that, Chris. Well, part of my title, I hate these titles, but I'm president of the National Optometric Association. It's an organization dedicated to advancing the visual health of minority population. So, educating and increasing awareness about diabetes and diabetes eye health and our minority patients is so important. And one of the things that I've observed for our patients during the pandemic, the two pandemics, diabetes is a pandemic in itself, and then you have the COVID-19 pandemic, is that a lot of the minority patients were frontline workers, right? They were the ones that were working during the very start of this, and they could not follow through or follow up with their health care. So a lot of them went without the necessary medication. I saw so many patients that have come back since our clinics opened. Although there was telehealth, a lot of patients may have had difficulty accessing telehealth. And a lot of patients have come back and they weren't compliant to their medication. And unfortunately, their diabetes or management of their diabetes was not well. Their numbers were elevated. Also, too, there are other issues. A lot of the minority patients were hit when it comes to social determinants of health, right? For example, financial barriers, having insurance versus not having insurance. A lot of minority patients lost their jobs during the pandemic, and that may have, or their insurance with the job, and that precluded them from getting A, healthcare, B, eye care, right? And then, of course, Chris, during 2020 has opened up our eyes to so much, not just the COVID-19 pandemic, but the racial pandemic that has been, unfortunately, always there. And so the racial disparities in healthcare really came, the conversation around that has been a lot more, and it is an issue. And that's something that has been affecting people from getting quality healthcare, the neighborhoods that they are, maybe access to good healthcare, transportation issues, in some perceived biases. When we talk about the COVID-19 vaccination, it went well in certain communities, but in minority communities, there was hesitation to get the vaccination, or because of lack of trust in the healthcare team, or lack of trust in healthcare because of some of the prior studies that showed some issues. And so our patients with diabetes were also affected. And unfortunately, and I think Dr. Gabe can attest to this, patients that had diabetes and developed COVID-19, unfortunately, in some cases did not have a good outcome with that. And so for me, one of the things that I've incorporated in talking to my patients is to make sure that their A1C levels are well controlled so that they don't get COVID. They're not going to get the injections, and really it's really talking to them about getting the COVID-19 injection, but really better control of their disease to minimize the adverse effect or the poor outcome from diabetes if their diabetes is well controlled. So those are the things that we're seeing. And because of that, I would suspect that more of my patients have more retinopathy, right? Because they're not well controlled. They have not seen their doctors. They're not on their medication as they should be because of some of these issues. So that's how it really has impacted the minority community. Dr. Gabe?
Dr. Gabe, I'd love to hear your take on those underserved communities and how it's affecting the diabetes population.
Yeah, and thank you, Chris. And Dr. Reynolds brings up a really important point. I think COVID has done a lot of things for the world, obviously, horrible things. And one thing it's really done is shine a bright light on some age-old problems, and the racial inequities in healthcare couldn't be more stark. And outcomes in relation to COVID help to sort of dramatize that. And so that's why the American Diabetes Association has taken a strong stand and started a platform called Health Equity Now that you can find more information on our website. It includes a patient bill of rights that everybody should have access, for example, to good health care, to healthy food, to the best technology, to the right providers, all of these things which we know does not exist right now. The other thing I wanted to follow up on that Dr. Reynolds mentioned that I think is worth highlighting is the number of individuals that have missed appointments because of the pandemic. And now that the pandemic has gone on, sadly for as long as it has, we just did a national survey that confirmed what we were afraid of, that a large percentage of people have missed appointments, multiple appointments with their healthcare provider, and that typically leads to worse outcomes. And certainly people we talked earlier about how important it is for people to get their yearly eye exam. Well, the pandemic's gone on longer than a year. Many people have not gotten their exams. It's time to call back and set up those appointments.
I think that's so important. In the pandemic, like you said, it has shined a light on so many disparities. And the best thing we can do now is give these resources to all of the communities. Accessibility is an issue, and it's always been an issue, but as providers, as patients, as thought leaders, or whoever we need to provide those resources. Going into one of my last questions for these health experts before we go into our patient panel, are there any steps, this is for everyone, are there any steps that we can do, especially in the pandemic right now? Are there any steps we can take to help protect against the diabetic eye disease? Is there anything we can do? Anyone listening right now, what would be your best piece of advice for those steps? We can start with you, Dr. Singh.
I would tell people that healthcare is widely available for us in the United States. We have optometrists, which they're plentiful optometrists. There's plentiful ophthalmologists. There's retina specialists like myself who are ready and willing to take care of people. We've created a safe environment now after the COVID pandemic, which is still ongoing, to see these patients, all of these aspects. So we have the ability to give good examinations now through these structures and these places. And so those patients shouldn't feel like this is not the right time to come out and get their examinations and get their screenings done. This is the perfect time to do it. This is the time that you've waited for. I think the last year has been interesting for a lot of different reasons, but one of the things that I think we've been able to realize is our health is very valuable through this pandemic. And so getting back and doing some of the preventative measures that are important, like the examination with people like me or with Dr. Reynolds or others in our community, is super important to do so. And it's accessible to all. So please feel free to come and see one of us to help you get the right screening you need.
I love that so much. Dr. Reynolds, do you have anything to add to that? Any steps that you feel like are important for people to protect against diabetic eye disease?
Well, I think the first thing Dr. Singh said is it's so important to get your eyes evaluated. You know, one of the most feared loss, Chris, is loss of vision. You know, people rather lose something else, a limb, than lose their vision. So it's so important. Anyone listening, if you have friends, family, anyone with diabetes, to let them know it's important to have a comprehensive eye exam to see their healthcare practitioner, their PCP, but also to, you know, I always tell my patients with diabetes, the ABCs of diabetes. So I can't stress that enough. So if I can have everyone in the audience know that glycemic control is so critically important, and knowing your numbers matter, right? So know your numbers. It should be 7 or less is really what's recommended. In some cases, it could be 6.5 or lower, but really know your numbers. Talk to your doctor, be a partner. I think Natalie said it earlier, be a partner in your care. Take your medication, right? And not just your patient, the medication for diabetes. You know, diabetes, the National Optometric Association has a 3 silent killers campaign, right, Chris? And there's no symptoms sometimes with diabetes, and there's no symptoms with high blood pressure or cholesterol, but these diseases can kill you. And so I always tell my patients, and I want everyone to know, an eye exam is more than just saving sight. We can potentially save your life. So it's so important to have a yearly comprehensive eye exam. Make sure you're taking care of yourself, your ABCs of diabetes, take your blood pressure medication, know your cholesterol levels. And most importantly, if you could, stop smoking, eat healthy, and exercise. That will help you help yourselves, help to sort of slow down the changes that could occur with diabetes.
Wow, everyone, let's take a second to rewind that. It's not just saving your vision. Yeah. It could help save your life.
That's right.
That's why it's so important to talk with your eye care specialist, to your diabetes management team, to be your own patient advocate, like Natalie said. It's so important. I can't wait to get into that. Dr. Gray, I'd love to hear your steps on helping to, you know, reduce that, protect against diabetic eye disease. What is your take on that? What's your giveaway?
Yeah, I think bottom line, it's plug back in, right? Because people have plugged out for a whole host of reasons during the pandemic. It's time to plug back in. Go see your healthcare provider, whoever manages your diabetes, whether that's your primary care provider, your endocrinologist, whoever that is, and then get your, I mean, we can't say it often enough, but we need to, because only half of the people are doing it. See your eye health care professional. It really can save your sight. And, you know, again, the comment that was made earlier by Dr. Singh, if we catch it early enough, people don't need to lose their eyesight. And it just should not happen. So plug back in. Reach out to your healthcare team. And I really applaud the ABCs, A1C, blood pressure, cholesterol. You manage those 3 things and get your screenings like eye care, you can prevent most of the bad things that happen with can happen with diabetes.
I met a diabetes educator who told me, you know, diabetes management is one thing, but so is life management as well. So hearing you guys talk about the outside factors, the lifestyle factors, and other medications, it's so important to talk with your either eye care or diabetes management team to get this. Now, as patients, Natalie, we're going to shift a little bit away from these experts. We're going to talk patient to patient, but experts, feel free to yell at us if you need to. Feel free to drop your 2 cents. I know for me with the pandemic, it's scary because I have an autoimmune disease. Having diabetes and going through a pandemic, which is already fear-inducing, it can be tough. So I want to see how the pandemic kind of affected your diabetes management, Natalie.
My diabetes management is best when I have a routine. And so the pandemic, while I'm extremely fortunate that I have my bases covered, I have health insurance, I can get my insulin, my entire routine changed. So it was very important for me to reset what that looked like for me, which, meant changing things up a little bit, but I wanted to be consistent of what types of food I'm eating and when I'm eating, and also working out, which first for a while was just in my apartment. Now that it's nicer, I go out for walks every day, which doesn't just help my physical health, but my mental health as well.
Okay. And I mean, I agree with that personally. As a patient with diabetes, doing the things that I could. Obviously, we had to adapt around the situation. We had to work out differently, try and eat differently, not just sit at home and consume whatever we want. All the lifestyle factors, we had to try and control the controllables. And that's what I try and teach people is focus on what we can control. We start to stress about things we can't control, and that stress is going to hurt us. So I like that you kind of went in that. How else did you stay on top of your eye health, your eye care? Is there anything specific you did? Were you able to still go to your annual eye appointment?
Yeah, so I definitely, I've learned my lesson. I will go to my eye appointments. I also was receiving eye injections, laser, and I had actually had eye surgery throughout the pandemic. So with some of the appointments were through telehealth, which you don't have to go anywhere, but with eye care, I definitely had to go in. I was nervous at first, but everything was very safe. And I know it's very important to just put my health first. So that's why I was going to my appointments. I'm also very aware now of my eyesight. I never really noticed that when my blood sugar went high or low, that my vision changed, but I definitely noticed now. And if I ever noticed a day where my eyes aren't focusing correctly, or I'm seeing something a little differently, I just make a call. Sometimes I used to be nervous to do that, but I know now if I make a call, they could say to me, sounds fine, it's normal, or they'll have me come in just to do a double check. I know prevention is key, and so I try to keep that up even during the COVID crisis.
So you discussed a little bit of your current vision, and what does your eye appointment look like as a person with diabetes?
Yes, so each appointment could be a little bit different. I have my general checkup appointments, and then I have my treatment appointments, but they all start the same. So I'm always making sure to see what my actual vision is, using both eyes just to make sure that if they've changed or not changed. I always hope for either unchanged or better. And then I move into the pressure check that usually tests your glaucoma. That's when they put the puff in your eye. And then they're always dilated for all of those really deep texts into your eye from both the doctors and also all of the scans you have. I usually have a couple of different types of scans, and depending on angling of my eye, just to make sure that that retina is looking good. And then I'm always having that final review to see what's going on, to sign up for any new appointments. And I'm always making sure that I'm asking those questions. No question is too silly or too stupid. And I'm very open now of actually how I'm feeling. So last time I had an appointment, I was feeling a little anxious, and I actually called it out. I said, hi, today I'm feeling anxious about it. And I've never done that before in my 30-year career as a type 1 diabetic, but it actually was really helpful because it caused the doctor to really fully explain what was happening and what was going on. And every time I leave, I actually feel more optimistic that the steps that I'm taking today are going to help my vision in the future.
That is awesome. I love that you brought that up, the communication piece. For me, I feel like when I was personally diagnosed, this is my personal, experience. The people I encountered didn't really discuss or expose the importance of eye health. It was almost minimized. So for so long, I didn't go and get my appointments regularly. I didn't do that because I didn't know. And I figured, oh, my blood sugars are good. I'm fine. And as long as my numbers are good, I'll be good. And I know Dr. Singh, Dr. Reynolds, or Dr. Gabe could probably add to that. A lot of people might feel like if your diabetes management is good, maybe I don't have to. But as we've heard from this call, so many people aren't going to their appointments. So many symptoms haven't shown up. Like Dr. Singh and Dr. Gabe said, it's so important to do that proactive approach with your eye care team. And I know for me, it took me a while in my beginning diabetes management to learn that. And now I'm such an advocate for the community, for our community. You said, Natalie, early on, being like a patient advocate. I think it's important to hear it from other patients, like, hey, make sure you go to your eye appointment. When's the last time you got your eye appointment? To have those internal dialogues and that communication amongst our peers and amongst our professionals so that, this condition that none of us asked for, we're managing to the best of our ability so that we're living with diabetes, not for diabetes.
That's a really great point, Chris, because I feel like people are just nervous around the word complication. Complication
Absolutely.
feels as though you did something wrong or something bad happened. I actually had no idea as well that retinopathy could appear just by having diabetes for such a long period of time. And so when I was diagnosed and they asked how long, I actually had to take a step back and think, oh, I didn't really cause this to myself. It's not because of something that I did. Now I can manage my diabetes. I can do the best that I can, but I also need to be aware that there's so many things that are going on, and it's nothing to be ashamed about if you're diagnosed with an eye complication, because science is wonderful, right? There's so much has happened the past 5-10 years. And so now that I know that, my entire approach and the way that I talk about it has changed, because I don't feel like it's something that is occurring to me. It's something that I'm managing and dealing with on a day-to-day basis. And I'm aiming to keep this vision for a really long time.
Definitely. I think that's huge. And it sounds like you have a lot of experience with this. Do you have any like long lasting tips that you would give someone, given the position you're in now? What tips would you give to our fellow people with diabetes about staying on top of their eye health, especially during the pandemic right now?
Well, the first two are making sure your diabetes is the best controlled as you can be. That doesn't mean perfect, by the way. None of us are perfect on every day-to-day basis. Also making sure you're getting the eye treatments and also your endocrinologist as much as you can. But what's also important is the community. There's a big community out there. Focus on Diabetes has a Facebook group that you can go on as well. A lot of cases, if I was going to a new procedure, I would reach out because sometimes I like the nitty-gritty story from someone else who has actually gone through it. And people who've gone through this process are really open and willing to speak about it. So I really encourage you, as much as you can and as much as you feel comfortable, reach out, talk to other people. That mental health aspect is so important, because as I've learned, when I'm not feeling great or I'm feeling resentful or other things are going on, my control in general just goes by the wayside. So I really encourage you to think about that. And at the end of the day, if there's something that comes up, if there's a complication that arises, there are treatments available. I know it can be really scary, but I'm living proof you can go through them and you can definitely thrive afterwards.
I love that. And I think a big thing I take away from you is that communication piece. Communicating with your healthcare providers, with your eye care specialists, to know that, hey, this is normal. Eye care, eye health, these appointments, these questions, these concerns, this is normal. You're not isolated or weird for having these questions, and it's going to help calm you down and take your education, take your healthcare seriously, so that we don't have 50% of people showing up. We have 100% of our people showing up, our people in our communities, your patients as healthcare providers. We need to continue these conversations, make these people feel comfortable with a condition that's already hard to deal with, especially on top of pandemic. So thank you, Natalie. Thank you to our health experts for going through these questions. I think we want to open it up for Q&A. I'm just not sure where they're going to pop up.
Chris, can I just add something really
Absolutely.
to what Natalie said? The
Absolutely.
other thing that she brought up was glaucoma. So there are other eye conditions or eye diseases that that was so important that you brought that up, Natalie. Thank you so much. So patients with diabetes are more likely to develop glaucoma. So it's just not the retinopathy. So I'm glad that you brought up the glaucoma test. But also too, I just wanted to add, I think for a lot of the patients with diabetes, family is so important, that the family is part of the team, because when it comes to the 50% not coming in, it's truly the family members, right, that brings them in. So, even the mental health component that you brought up, Natalie, it's a family disease. So my aunt had diabetes, and I saw her suffer. She lost her vision. She lost, parts of her, some toes from the disease. She was on dialysis, and then unfortunately she had a massive stroke from this disease, and it affected all of us and her children. So I always say diabetes is not just the patient alone, but a family concern, because it's a family member that typically brings them in for the eye exam. especially the younger patients, it's mom and dad. For our older patients, it's usually the wife or the spouse that's typically there that we have to educate and also talk to about the disease and their eye condition. So family is very important when it comes to not suffering alone. I just wanted to mention that.
So I saw a few questions and people were asking, is there a target range for your blood sugar? Is there a target range? And I think a lot of people are looking for the perfect answer, but I'd love for Dr. Gabe or Dr. Singh to kind of go into that. Is there a target range that we want to shoot for?
Yeah, no, it's a great question. And so, first of all, maybe I'll just for people that may not be familiar. So we talk about this A1C measure, and that's your average over 3 months. And that's the most important number to pay attention to. Now, how do you get to a good average? Well, on a regular basis, you're trying to stay within range. But as Natalie said, nobody's perfect. I've yet to see in the thousands of patients I've cared for anybody that's perfect. Like, it just doesn't exist. So don't worry if you're not perfect, but try to stay in range as much as you can. And so where does one think about that? So let's say before meals, in the 90 to 120 range would be 80 to 120. Anywhere in there is fantastic. But really what your goal is where you are now to try to get a little bit better. So you may be in the 200s or the 250s. All right, let's just try to get it less than 100. That's your goal. You don't have to get all the way there. And sometimes it's not good to get all the way there too quickly. So figure out where you are and then start moving in that direction and work with your healthcare team to help get there.
Yeah, I can bookend that comment. I think for every 1% decline in the hemoglobin A1C, there's a 50% reduction in the progression to diabetic retinopathy. So Chris, you can imagine if you're sitting at like a 9 or 10, think about the reduction you can take on your future by reducing closer to 7. It's a huge amount, and so really impactful if you can do it.
I think that's great. Now, a lot of people have other questions. Should both eyes be checked by a radiology tech, or should both eyes be radiographed?
I think that they're referring to some of the pictures that we do in clinic, and photographers or sometimes ophthalmic technicians do these pictures for us in clinic to document disease. There's a variety of different ones that are available. The camera that Dr. Reynolds spoke about before is a highly technical device that looks at blood vessels. But the traditional one is just a picture of the back of the eye. That's a fundus camera. And it'd be nice for both eyes to be both checked by the optometrist or the ophthalmologist and a picture be taken, because we find that patients who have both a picture plus the examination have a higher rate of sensitivity for screening and picking up disease than if we do one or the other alone. So they work in complementary ways to help identify disease.
Thank you for clearing that up. Now, someone
That's
also
too, Chris, really important. If you can see it, you believe it. And so when we take the retinal photography, we usually educate our patients with that. So if they can see the bleeding, I see in the chat, no reason to go. My patients all the time, I let them know what's going on in the back of the eyes so they could see why it's important to do the follow-up care, why it's important to see the retinal specialist, because they see the changes in the back of their eyes. So the retinal photography that we do is not just to detect the disease and watch for progression, but also for education of the patients as well.
I think that's extremely important. The education piece is extremely important for people with diabetes. Now, some people are asking the difference between seeing an ophthalmologist or an optometrist for your diabetes care. Does someone want to address that?
I do. I think it's so, as Dr. Singh says, there's more optometrists than there are ophthalmologists or retinal specialists. So again, an optometrist does a comprehensive dilated eye exam. We're part of the healthcare team. We can detect signs of diabetes in the back of the eye, in the front of the eye changes. And so it's important to see an optometrist, but of course, ophthalmologists, you have some general ophthalmologists that do exactly what optometrists can do. We could dilate the eyes, we could take the retinal imaging, retinal photos. We could utilize some of the advanced technologies in early detection. And then Dr. Singh is a medical doctor, a retinal specialist. And so if there are changes in the back of the eyes, there is bleeding, or the patient has moderate disease, typically with mild disease, we can manage those with close follow-up of the patients. When the patients have moderate or severe disease, or they have advanced bleeding in the back of the eyes, that's where Dr. Singh comes in. And we refer the patients. We work collaboratively to make sure the patients get the best care. A lot of our patients, especially my minority patients, are afraid of eye injections. Natalie, it's interesting that you brought up your perspective. They're so, oh, my friend goes to her doctor and he puts this needle in their eyes. And so patients have genuine fears that I can address for them, as well as make sure that when I'm referring them to the retinal specialist, they have good care, and I see them back. A lot of times I see them back for follow-up to make sure, they went. A lot of times they don't follow up and see Dr. Singh. So I want to make sure that they see Dr. Singh. So we're an important part of the healthcare team. And also to all of your eye doctors, optometrists, ophthalmologists should be communicating with your healthcare practitioner, the PCP, the endocrinologist, to let them know what's going on with you as far as your diabetes control, whether your management of disease or management of the medication needs to be altered because now you have retinopathy or changes or you're not well controlled. So an optometrist is an important component. And I know that a lot of times we think if it's just a Walmart doctor that they don't do a dilated eye exam, but they do a dilated comprehensive eye exam. All of the schools and colleges of optometry teach our students to be awesome eye care doctors and to dilate all their patients.
I love that we keep having this theme of communication, with ourselves, with patients, with our healthcare providers, to make sure that we're just doing the things that will help us live a better quality of life. Now, someone has a question for Dr. Singh. What is the impact of missing one of those annual eye exams, and how do we get back on track as a patient with diabetes?
Chris, it could be huge if the patient's getting active treatment or has advanced disease. And we found this in a study we did recently where we looked at patients who had a significant loss of follow-up to our clinics and found huge differences when they came back to us with regards to their vision and what happened. We've also found some study research work during the pandemic that if you didn't come in for a visit because you had an eye care appointment and you happen to be on active treatment for some of the diseases we take care of, you lost about a line of vision in just that small period of time, about 3 to 4 weeks. A line of vision could be the difference between not driving and driving. It's between seeing things on your plate and not seeing things at all. It's about, having depth perception and not having depth perception. So a line of vision is significant. And I think that's what people need to understand better, is that we have the ability to obviously screen these patients now, and we just need the opportunity to do so.
I think that's an awesome question. Go ahead.
Well, I was just going to add, so sometimes people wonder, why do we say a yearly eye exam? Why is it not every 2 years or 3 years? So they've actually done research to say, how long does it take for eye disease to progress, and where should the next appointment be? And for most people, it's a year later. So if you miss that year appointment, you've now let things go to a point where it can be causing significant damage to the eye. So these recommendations are based on real science, where people have really studied whether, it's 18 months or 2 years or 1 year. It's 1 year. And for some people, as we mentioned earlier, it may be even sooner because they have more active disease. And those people really need to call their eye professional and get back in.
I think that is a vital way to end these questions, to understand we really need to communicate with our healthcare professionals, our eye care professionals, especially having diabetes during the pandemic. Now that we're wrapping up the questions, there's no more questions for our panelists. I want to give the panelists one more opportunity. Is there anything you want to leave people with before we wrap up this roundtable discussion? We can start with you, Dr. Singh.
I think the emerging data for the past few years in clinical trials and studies have just shown a transformation in the way we take care of patients. 40 years ago, there was no treatment for diabetic retinopathy. Now we can have 40 years of patients with sight because of these treatments. And I hope people watching at home know that there's a lot of hope out there. There's ongoing research to even do better at what we're doing, which is pretty amazing. And it's the reason why I love getting up in the morning and take care of patients, because we make such a difference in their lives, and I hope they feel the same.
I love hearing that. Dr. Gabe, anything you want to leave people with?
Yeah, first of all, this effort, and appreciate everyone on the panel being involved in this, and Chris, you moderating this discussion. It's crucially important. The American Diabetes Association has taken on this challenge of a focus on diabetes, on a focus on eye health, because we believe and we know that we can prevent blindness, and that in this day and age, we do not need to have people with diabetes become blind. And what that requires, step one is going to see your eye care professional. Do that. If you take one thing out of today's session, make sure you make that appointment, and then plug into the rest of your healthcare team, because we together can prevent blindness.
I love that plug-in comment. And it's just so simple, but so impactful to understand. Plug back in, get back in there. Dr. Reynolds, what do you want to leave people with?
My colleague said it so well. I just think everyone in the audience, friends and family, you do not have to go blind from diabetes. You do not have to die from diabetes. It's a controllable disease. We just need you to partner with us to help you control your disease better. And that includes coming to see me every year to make sure there's early detection of eye disease. Make sure you see your primary care physician or endocrinologist every 3 months or quarterly. Make sure that you're taking your medication, and more importantly, lifestyle changes. As Dr. Singh said, just a small change in controlling your glycemic control can prevent you from getting changes in the back of your eyes. And so, you don't have to go blind from diabetes. Come to see me every year.
You said something vital. You said partner with your healthcare providers, not just see them, but partner with them. This is a team, diabetes healthcare team. You're part of that as a patient. I'm part of that as a patient. I want to feel like I have partners. And it's so nice to hear you all speak from that perspective. And Natalie, I'm sure you feel the same way to hear this. What are your takeaways or your giveaways, so to speak, as a person with diabetes going through the pandemic and going through everything you've gone through to be where you are now?
At the end of the day, you are your own best advocate. Think about the things that you enjoy and appreciate. I love to travel and spend time with family and friends. I know a lot of this can be overwhelming, like you can't do it all, or that you're just scared of what's going on. But what is scarier to me is not being able to do the things that I love to do. So it might feel scary, but if you communicate, take care of yourself, you can definitely manage it and have great eyesight.
I 100% agree. And in closing this event, I will say that in focusing on what you can control, you take away a lot of stress in life, and you put the power back in you as the patient to talk with your providers, the team, so to speak, the partners, plugging back in with those people, focusing on what you can control, that so that this condition doesn't run our lives, it just runs with us. We didn't ask for it, but it is our responsibility, or our response ability, our ability to respond by using our healthcare team and our providers to make this just a little bit better, to help treat if we need to, or get the support we need for a condition that is not always fun, but as all of our healthcare providers have said, it can be manageable. Thank you so much for the ADA for having this roundtable discussion, Healthy Vision Month and Focus on Diabetes initiative. There's so many resources you can visit, like looktoyourfuture.com. Thank you for our health experts. Thank you for our patients. Thank you for watching, listening. Please continue looking towards ADA for any further information, and I hope to see you all in the near future.